it or
positive. I think as a primary care doctor, people are using this stuff, and it's our responsibility to learn and be able to educate them a little bit, especially things like drug interactions, affecting your liver. These are things I hadn't thought about to really say, like, just you think about the lungs, because a lot of people smoke it, but there are a lot of other things I learned tonight that I didn't know, that I feel like as a physician, I have an obligation to be able to share this with my patients. Okay, I am Dr. Tisha Rowe. I'm a family medicine physician, and I have been practicing for 13 years.
great. And how were you feeling about your knowledge of cannabis before this training today?
Barely any. I personal like experiences, as I mentioned, I use CBD but not cannabis, and just nothing really. So I've always been curious but never intentionally sought out any CBD, any cannabis education. So I found this informative and kind of leaving me wanting to learn more. um I think it was very thorough, like from dosing, side effects, several terms I'd never heard. And I thought it was really well done.
Thank you. And then how are you feeling after the training? Is it sort of
I feel like I'm curious. So I think I answered that kind of
yeah,
prematurely, but
okay.
I feel more confident and wanting to learn more because of what I've learned.
And what was the biggest challenge that you were facing about cannabis, learning about it, or as we talked, that was addressed?
Uh, I think maybe the biggest challenge is dosing, because you kind of think about it as something that's recreational. So actually seeing some numbers like, oh, start here. These are recommendations. This is high, this is low, this is the different formulations, this is a difference, absorption. Those are the things I want to be able to answer for a patient if I'm recommending something, and I definitely did not feel like I could before.
Great. And then, is there anything particular today that resonated or that you found helpful? The dosing you mentioned already. So,
I think just the different applications that I had never crossed my mind before. Pelvic pain, you think about it like, oh, people, I've thought about it, like I know people self-medicate for anxiety. I know cancer patients use it for pain, but I do a lot of women's health. So things like the pelvic pain, that was definitely something that made me want to research more, look into it more. And also, the other thing was knowing that there's so many different ways to utilize it, because all I'd heard about before this talk was smoking it or gummies. Like, and so to know that there's a vaporizer, there's under the tongue, there's a suppository. I had no idea that you could, the topical, knowing about the absorption. I didn't know that these were so many different ways.
if there was anyone who was watching and they were curious to know more about this training stuff, what would you tell them?
To reach out to you on LinkedIn.
There you go. Awesome.
Mhm.
So, but I mean, was there anything in terms of um anything you would tell them in terms of just kind of your experience or
It was
why they should
definitely
do it or
positive. I think as a primary care doctor, people are using this stuff, and it's our responsibility to learn and be able to educate them a little bit, especially things like drug interactions, affecting your liver. These are things I hadn't thought about to really say, like, just you think about the lungs, because a lot of people smoke it, but there are a lot of other things I learned tonight that I didn't know, that I feel like as a physician, I have an obligation to be able to share this with my patients.